Do you wish you had more reviews prior to an exam? Do you want not only review material, but to understand how to read the questions and get the correct answers? There are some very specific strategies you can use with NCLEX style questions to help you do just that. This is Professor Wick from RN2 Professors, and I'm going to do a review with you on NCLEX style questions focusing on strokes. Stick around and I'll go through several questions to show you how to understand what they're asking and how to get the correct answer. NCLEX questions related to strokes are common on exams and boards. It is important to know that there are two types of strokes, hemorrhagic and ischemic. They both have different causes and risk factors. However, the symptoms are common regardless the type. In this video, I will review questions related to both. For additional quizzes, tips, and freebies, follow us on our other platforms. Let's review. The client diagnosed with atrial fibrillation has experienced a transient ischemic attack, a TIA. Which medication would the nurse anticipate being ordered for the client on discharge? Number 1, an oral anticoagulant medication. Number 2, a beta blocker medication. Number 3, an antihyperemic medication. Number 4, a thrombolytic medication. This is an analysis question in the planning phase of the nursing process. The key in this question is there are two disease processes mentioned, atrial fibrillation and TIA. To find the correct answer, you must determine how one affects the other. Read through the answers and pick the medication that best fits the scenario. Number 1, an oral anticoagulant medication. Number 2, a beta blocker medication. Number 3, an antihyperemic medication. Number 4, a thrombolytic medication. The correct answer is number 1. Atrial fibrillation predisposes the patient to formation of thrombi, which become embolytic and may cause a TIA or CVA. The nurse would anticipate an oral anticoagulant, like warfarin, to be prescribed to help the patient prevent thrombi from forming in the atria. The other medications are not used to prevent thrombi. Beta blockers slow the heart rate and decrease blood pressure, and antihyperemic medication is for gout. A thrombolytic medication is administered to dissolve a clot, and it may be ordered during the initial presentation for a client with a CVA, but not on discharge. Here's our next question. The 85-year-old client diagnosed with a stroke is complaining of a severe headache. Which intervention should the nurse implement first? Number 1, administer a non-narcotic analgesic. Number 2, prepare for stat MRI. Number 3, start an IV infusion of D5W at 100 milliliters an hour. Number 4, complete a neurological assessment. This is an analysis question in the implementation phase of the nursing process. The word first in the STEM tells you that this is a priority question. One strategy to answering priority questions is to determine the urgency of the situation. To do this, use Maslow's, the nursing process, and the ABCs. With this knowledge, read the answers again and pick the first thing the nurse should do in this situation. Number 1, administer a non-narcotic analgesic. Number 2, prepare for a stat MRI. Number 3, start an IV infusion of D5W at 100 milliliters an hour. Number 4, complete a neurological assessment. The correct answer is number 4. If the patient is not in distress, we must assess. The nurse must complete a neurological assessment to help determine the cause of the headache before taking any further action. The other answers may be needed, but you won't know which until after you assess the patient. Here's our next question. The nurse is planning care for a client experiencing agnosia, secondary to CVA. Which collaborative intervention will be included in the plan of care? Number 1. Observe the client swallowing for possible aspiration. Number 2. Position the client in a semi-Fowler's position when sleeping. Number 3. Place a suction setup at the client's bedside during meals. Number 4. Refer the client to an occupational therapist for an evaluation. This is an analysis question in the planning phase of the nursing process. The key word in the STEM to help you understand what the question is asking is collaborative. The question is asking you which intervention, which includes another healthcare discipline, is needed for this patient. Read through the answer again, looking for the collaborative intervention that fits the scenario. Number 1. Observe the client swallowing for possible aspiration. Number 2. Position the client in semi-Fowler's position when sleeping. Number 3. Place a suction setup at the client's bedside during meals. Number 4. Refer the client to an occupational therapist for an evaluation. The correct answer is number 4. Agnosia is a failure to recognize familiar objects, so an intervention with an OT is appropriate for this patient. The other answers were incorrect because they were not collaborative interventions. Here's another question. A 78-year-old client is admitted to the emergency department with numbness and weakness of the left arm and slurred speech. Which nursing intervention is a priority? Number 1. Prepare to administer RTPA. Number 2. Discuss the precipitating factors that cause the symptoms. Number 3. Schedule for a STAT CT scan of the head. Number 4. Notify the speech pathologist of an emergency consult. This is an analysis question in the implementation phase of the nursing process. This is also a priority question. There may be multiple answers that could fit this scenario, but only one is what should be done first. Use Maslow's, the nursing process, and the ABCs to determine the urgency of the situation given in the STEM. Read the answers over and choose which intervention should be done first. Number 1. Prepare to administer RTPA. Number 2. Discuss the precipitating factors that cause the symptoms. Number 3. Schedule for a STAT CT scan of the head. 4. Notify the speech pathologist for an emergency consult. The answer is number 3. A CT scan will determine if the client is having a stroke, has a brain tumor, or another neurological disorder. If a CVA is diagnosed, the CT scan can determine if it is hemorrhagic or ischemic and guide you to treatment. The other answers are interventions that can be done, but depend on what the diagnosis is. Final question. The client diagnosed with a right-sided CVA is admitted to the rehabilitation unit. Which intervention should be included in the nursing care plan? Select all that apply. Number 1. Position the client to prevent shoulder adduction. Number 2. Turn and reposition the client every shift. Number 3. Encourage the client to move the affected side. Number 4. Perform quadriceps exercises 3 times a day. Number 5. Instruct the client to hold the fingers in a fist. This is an analysis question in the planning phase of the nursing process. It is also a select all that applies question. The key word in this question is interventions. Make sure the answers that you pick not only fit the situation, but also follow the rules of how a nursing intervention is written. Read through each answer and determine if it fits the question. Remember that this is an all that applies question, so one answer does not rule out another. Number 1. Position the client to prevent shoulder adduction. Number 2. turn and reposition the client every shift. Number 3, encourage the client to move the affected side. Number 4, perform quadriceps exercises 3 times a day. Number 5, instruct the client to hold the fingers in a fist. The correct answers are 1 and 3. Placing a small pillow under the shoulder will prevent the shoulder from adducting towards the chest and developing a contracture. The client should not ignore the paralyzed side, and the nurse must encourage the client to move it as much as possible. A written schedule may assist the client in exercising. Numbers 2 and 4 are incorrect because of the time frame given. Both need to be done more frequently. Number 5 is incorrect because the patient's fingers should be positioned so that they are barely flexed to help prevent contracture of the hand. That's it for this review. Thank you for joining me today. If you like this video, check out the others in the series and click like, subscribe, and the bell to get notified when new videos are posted.